We'll have a moment of silent meditation and pledge to the flag. Thank you.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Call this meeting of the Monongalia County Commission to order. We are all present. Commissioner Sakura is on screen and participating, and it is July 22nd of 2020. So, okay. We'll begin with consents and approval. Lynetta.
Good morning.
Good morning.
We have 23 exonerations for $680,795.12. 2 requests to create new statements for $2,094.14. No minutes. Vouchers General County Fund, $84,052.63. Coal severance, $9,245.56. 911, $31,165.49. Chestnut Ridge Park, $2,592.72. Camp Muffley, $1,821.50. Mason-Dixon Park, $1,805.22. Assessor's valuation, $2,177.98. Purchasing card vouchers. General County Fund, $26,563.79. 911, $9,009.29. Chestnut Ridge Park, $35.98. For a voucher total. Oh, okay, wait a minute, I missed one. Mason-Dixon Park, $9.49. For a voucher total of $168,479.65. We have several budget revisions. These are all in-house approval revisions for the general fund for fiscal year 20. We have County Commission, County Clerk, Circuit Clerk, Prosecuting Attorney, County Clerk Elections, Insurance Programs, Courthouse, Other Buildings, Data Processing, Dog Warden, Ag Agent, Day Report Center, Federal Grants, Flood Control, State Grants, and Control Garage. And these are all just to correct negative line items, so we're just moving some money around within those budgets. Position vacancies for boards and authorities are Western Board of Zoning Appeals, Mon County Planning Commission, Monongalia County Development Authority, Camp Muffley Advisory Board, Abandoned and Dilapidated Enforcement Agency, Mason-Dixon Park Advisory Board, Region 6 Planning and Development Council, Historic Landmarks Commission, and the Mountaineer Trail Network Authority. Fiduciary orders for July 22nd, 2020.
Move for approval.
Second. It's been properly moved and second for approval. All in favor?
Aye.
Thank you.
Okay. I don't see any listed, but do we have any introductions of new employees? If not, we'll move on to comments from the public. We're now open for comments from the public. If you wish to speak, please come forward, identify yourself. You have 3 minutes.
Yes, my name is Chuck Dusty. I'm a veteran. I live here. I've lived here all my life. My family lives on the family farm from several generations back. I am currently president of Operation Activate, a nonprofit, all-volunteer veterans organization. The main purpose of Activate is to get veterans out of the house and do activities. Many veterans deal with anxiety, depression, and PTS. As a result, they tend to withdraw into their homes and do not function in social events. The Veterans Administration says that 22 veterans a day commit suicide. Activity's mission is to help veterans get out of the house and do activities to help them deal with these problems. We take veterans camping, fishing, hunting, bowling, playing paintball, basketball, and softball, and other group activities. I just had to cancel 3 major events because of the limitations placed on Mon County. Our picnic, our 8K, and our motorcycle ride, even though they were all outdoor events. Why? Oh, the numbers are going up. So their answer is to shut down bars, churches, and no large gatherings like veterans events. Oh, yeah, and put a diaper on your face. I fully realize this is a real threat. People have gotten sick and died from this virus. I also see the national news that some of this virus, some of these numbers are grossly exaggerated in Florida, Texas, and California. I believe this is happening here also. I know 2 ladies who filled out paperwork, did not get tested, and got test results back being positive. How is that possible? Furthermore, I have not heard anyone say anything about the numbers jumping in Mon County being connected to the protests and the W athletes coming back to town. The last number I heard was 28 football players testing positive. What's going to happen when 25 to 30,000 students come back to town? Do you really believe they will all social distance and wear masks away from the campus? No house parties? I do not understand the pick and choose methods that these rules are applied. I have been told by a mental health expert that suicides, child abuse, and domestic violence are all on the rise. Who is keeping track of these numbers? For veterans who are already suffering, this is magnified many times over. Where this all goes, I don't know. However, one blanket plan does not work for everyone. Veterans have already risked life and limb. Give us the rights that we gave you. Let us make our own choices dealing with the virus or being locked in our own basement to die. God bless our veterans and God bless America.
Thank you.
Is there anyone else who wishes to come forward and speak? Seeing none, we will close the comments from the public. Colleen, have we any grants? We do not. Correspondence, Renata?
I don't believe I have any.
Okay. Do we, the commissioners, have correspondence? Sean?
Yes, I do. I have, I believe we received an email from Parker Grimes regarding to the commission regarding the Board of Zoning Appeals. So if we could put that on to make a note of that so that we discuss it in staff reports and possibly a future work session. I also received an email this morning from a gentleman regarding broadband in the Snake Hill area. That too is something that the same individual has emailed me before, and I really, obviously with what's going on with school in the fall, we really should probably speed up or motivate or get our conversation going in regards to what we can possibly do in the county to better provide broadband access. Because this is going to be happening all over the state, and we should get out in front of it. I suggest we probably either, whether we're asking for industry to come to us and give us proposals or suggestions as to what could be done in the area, to work with our Region 6 people who take some of the plans that they've already done and try to see if we can get those put into a project plan that we could actually agree to, or a combination of all those factors, and probably need to involve the school board in that discussion too, as we've had some of those discussions previously that, we'd like to do something. We got head nods that yes, that's something we're really interested in, and I really think we probably ought to get that ball rolling before. Obviously, we got school coming right on us, but there's no time like the present to at least get those things going. So if we can also put that on a staff report / work session discussion to see what we can do going forward, I appreciate it.
Tom?
No. None.
Okay, thank you. Is there any unfinished business?
No, sir.
Okay, hearing none, we'll move to new business. We have one item. It's consideration of intergovernmental agreements for dog warden services between County Commission and the municipalities for the period of July 1st, 2020 through June 30th, 2021.
Move for approval.
Second.
It's been properly moved.
With discussion.
Oh, please.
Go ahead.
I did want to point out that the cost for not for all municipalities, one municipality went up, Star Cities went up But overall, all municipalities as a group, the costs are going down this year. So this is a very favorable agreement. It's based off of a number that we came up with, a per call number, and those numbers calculated based off the calls they had last year. So everybody's numbers seem to be going down. Overall, I mean, Westover's numbers went down by 58%, and overall, all municipalities' numbers went down by 16%. So that's either the process that we had with getting the police involved and maybe doing an initial interview, or just good policing of animals in the county. So credit, I'm not really sure who the credit goes to, but we like to see those costs going down. And this is a heck of a bargain for all these municipalities.
Okay, good. It's been properly moved and second for approval. All in favor? Aye. Thank you. Reports from elected officials. I don't see anybody. Is anybody hiding
No.
behind the post? Okay. Reports from county commissioners. Tom?
Yeah. First, thank you for staying, Chuck, because we're not allowed to respond while you talk, but I think, it's worth responding to. And I do appreciate you wearing a mask, whether you approve or not. I do appreciate it, and I respect that. I'm going to thank you. The concern that you bring up, all the three commissioners are very worried about. The problem is that the governor makes the rules, and we're an arm of the government, and we are daily working with his officers and the other county officers to try and mitigate what is going on. And unfortunately, I know there were some real concerns, and I will bring it up. I'm sure all of us got a lot of phone calls concerning the Boy Scout camp. And the concern being that there were 300 individuals on 1,000 acres, and they weren't allowed because it was over 25, but you were allowed a softball game. And unfortunately, those were the governor's rules. We are having difficulty understanding his rules at times. So I can understand your frustration. That's all about the best I can answer it. Maybe the others will speak to it when it comes. The only other thing I want to say is that this has been a very challenging week, and I personally want to thank Renetta, Colleen, and my fellow commissioners for responding to several crises in a professional and very quick response. For those of you who don't know, we're almost on calls in the morning and evening when dealing with each crisis that comes, and it couldn't have been done without us all working together to come up with some sort of solution. And I want to say thank you.
Okay. Sean?
I'm done.
Sean?
Since last week, as Commissioner Bloom said, it has been a very busy week. Since last Thursday, I had my Monongalia Park Executive Committee meeting, my Red Team meeting, and in the afternoon we had a meeting with Dr. Ahmad, the new state health officer, Dr. Smith, and Morgantown mayor, talking about Mon County and just some of the things we're talking about now, where we're at, suggestions to get Charleston to allow us to manage our way out of this. And we're going to be following up on that call. So I appreciate Dr. Smith setting that up. And then in that evening, as Commissioner Bloom noted, we had an emergency call that the commission had to get on regarding one of our facilities. Saturday night, we've got about 13 different officials and elected officials, supervisors, representatives on the phone for a call to one, communicate current issues that were going on, to discuss possible steps, and to initiate an action plan. And I really appreciate everybody that jumped in, because as Commissioner Bloom said, these are tough times, and we're on the phone almost every day, dealing with the next question or the next issue of the day. So I appreciate everybody getting on that call so quickly. Yesterday I had my Juma committee update call, and then we had another staff call in the afternoon to discuss some county policy that we're going to discuss with all of our county elected officials this morning. Today's regular day, as I mentioned, we have our county officials call, and then we have an afternoon work session. Tomorrow I have Monongalia Park Executive Committee meeting, possible meeting with Dr. Ahmad. We have our follow-up call regarding the Justice Center, and then Friday we have staff reports. I continue to mention to people, just please stay vigilant. I appreciate everybody trying to pull together to work. The call we had last Monday, we had all municipalities on it. We had representatives from the health department and trying to just work through solutions. And I do have a comment, the gentleman from the Veterans Association. I'm not sure if I heard of your organization before. Did you say it was Active Vet?
Yes, sir, that is correct.
I would also encourage you, for one, I feel what you're going through, because we feel the same frustration. We're trying to get Charleston to allow us to manage ourselves, to get us through this, because you're right. We don't look like any other county in the state. We've got unique problems, we've got unique challenges. We need autonomy to be able to manage this crisis. We have probably the best health department in the state. So we need to be able to utilize the tools and work to work ourselves out of this crisis. We all have concerns about the fall and what that means with students coming back. And again, there is not a day that we don't, have some call or discussion in regards to what do we need, how are we going to get it, and how are we going to move forward. So I appreciate your frustration. We're dealing with it as best we can, and I hope that in the next couple months or the next couple weeks we can, some of the things we've already done, with pleading for help from Charleston, is starting to take root, and we hope that we can work through this. I would also suggest that you give your information to our county grants coordinator, because your organization may be interested, and since I haven't heard of your organization, it sounds very worthwhile. Your organization might be interested in participating in our annual grant program, where we give out approximately $1.3 million to organizations just like yours, that are people that are out there that are doing. And this county has a wonderful amount of great organizations that are out there just doing things. And every day I become aware, just like today, of another one where you're doing wonderful things on your own time to help people that have given everything for this country. So I really appreciate everything you're doing. I can't tell you that we're going to be able to solve this problem immediately, but we are working closely with all municipalities in the state and our health department to try to figure out how we can control this issue and get back to normal, whatever normal is going to be going forward. So again, we always appreciate hearing from the public, whether it's good or bad. We want to hear from you. So thank you very much for taking time to come in. That's all I have.
I have one issue I forgot, which is probably the most important issue that the three of us are going to be thrilled to announce. We have moved under the Harvard statistics out of the red district into the orange. We were at 44.2 per 100,000. We are now under 25, and that's one of the direct reasons for people listening and working with us and wearing the mask, washing hands, and social distance. I did want to say something positive. I forgot about that.
Thank you.
Tom, I did also want to make one more correction. Yesterday's paper had an article about the Justice Center, and the article said that the Bar Association advised its members to self-quarantine or get tested. When people have to realize that if you have contact with someone that has tested positive, contact is defined at closer than 6 feet for more than 15 minutes. Okay, there's three levels of scrutiny that people should adhere to. They're self-monitoring. They're doing things just social distance, cleanliness, sanitizing, those type of things. That's on everybody to do all the time. And then when you have an instance where you think you've been exposed, that's diagnosis. That's self-monitoring. And that's kind of like if you were in the Justice Center and, it's not saying you're in the Justice Center, you need to run out and get tested. You need to self-monitor. You need to, self-quarantine. If you have contact with a positive person and maybe it was not within those parameters, you just simply self-monitor. You don't run out and flood our hospitals with getting tested. And then when you develop symptoms, then you move into a quarantine stage, and that's when you should get tested. Because if you won't, I understand at least the major insurance won't cover you if you don't have symptoms when you go to get tested. So again, there's a lot of hysteria, but people, just like when the governor put out the order and said all masking. Well, they forget to say that there's masking, but when social distancing cannot be accomplished. We wanted them to clarify that. We still want them to clarify that, but there's always, little minutia that kind of gets left out. Same as contact. Contact is less than 6 feet, greater than 15 minutes. So but everybody should be vigilant, should be aware, but we don't want to cause mass hysteria by telling people, well, you are in a building, you need to go get tested, right, which is absolutely a wrong direction. That's all I have to say.
Sorry, Ed.
It's okay. I've many times said that speaking last is possibly the curse. That was my first item that Tom read, that we had went from going from red to orange in that Harvard metric. Our state also is no longer leading the nation in this metric, so that's good. I think we had a great Zoom meeting with Dr. Smith and Dr. Anya Amjad. I know I'm butchering her last name, but hopefully we might be able to be meeting with them again tomorrow, either in person or by Zoom. These are discussions of the issues that we have been trying to bring forth to, as Sean said, to allow us to make decisions here in the county relative to the health department, relative to what you spoke on. We are kind of powerless at this point in time, but if the state chooses to listen to us, then perhaps we can move forward in a direction that's positive for the state and for Monongalia County. Friday, Tom and I did meet with local restaurant owners, and I think that we are going to have a productive meeting today with Dr. Smith. And we've had, as Sean said, multiple conference calls. And last night's firemen's meeting was canceled. So, but we are scheduled next Tuesday to meet with the commissioners of Greene County. Now, we share a common border. We also share a park. And we share commonalities that we have been discussing by phone. It was once a week, and now it's been every other week. But we're going to meet and we're going to them and listen to how we can possibly economically and fruitfully develop a partnership between the two counties that share that border. And I did get to tour Mr. Doyle isn't here, but I would like to congratulate him because I did get to tour the new construction. There was a building, but it's being converted to a warehouse. It's going to be insulated, heated, air conditioning, and this is going to be a warehouse for storage of protective gear that we will have for now and in the future. So perhaps we won't be caught unawares if something doesn't go the way we want it. I like to congratulate everybody that that has helped us in this endeavor to go down. Let's stay safe. I really want our county to be open. I don't want it to have it closed. We'll hear what the governor has to say, but in light of what I see on the metrics, I'm hoping for at least neutral, positive conversation. Thank you.
Move to adjourn.
Second, we are adjourned.